And joining us live on the phone this morning is Governor Mike DeWine. Thank you so much, Governor, for taking your time to talk to us here at 19 News this morning. We do, of course, have a lot of questions for you. A lot of our constituents, a lot of people who watch us are really anxious about what's going on. A lot of job losses that we're seeing in terms of people out of work because of the shutdowns. I think what everyone wants to know is any idea how long this is going to last?
Well, we really don't know how long this is going to last, but, Dr. Amy Acton, who's my health director, and I think is doing a great job, says that we likely will peak out around May 1. No one really knows. So I think what people need to focus on, and I understand the great concern about being out of work, great concern about, basically the state shutting down, but we have to concentrate on the most important thing, and that is everyone staying alive, everyone doing everything they can not to spread this. Our big concern is that if we end up like Italy, we have a situation where the healthcare system, as great as it is, with Cleveland Clinic, all our great hospitals, all our great doctors, we don't want to overwhelm that, because if we do, we end up like Italy, where doctors are literally choosing who lives and who dies, or who gets the equipment, who does not get it, who gets the bed, who does not. So, look, we're going to get through this. We need to focus on our health right now and do everything that we can to get through this. And this is a case where the virus needs our help to grow and expand. That virus wants to multiply. It wants to go from one person to another. We have to do everything we can to block that from happening. So as much as we worry about the economy, worry about jobs, I fully get that, but the most pressing concern has to be on our own health. Look, the sun's going to come out again. The state is going to bounce back, as will the country, but we have to get through it first.
Governor, we know you guys are working with the federal partners as well. What are you specifically asking the federal government for? We understand there may be a governor's conference call with FEMA or the White House administrators today.
Well, we have a lot of conference calls, and we have a lot of contact with the federal government. One of the things that we are asking for is waivers, so that we can do things that we need to do to help people. I mean, an example is the Department of Agriculture. When we closed the schools down in Ohio, a lot of kids rely on feeding programs for lunch and breakfast. We wanted to have the ability to take that food outside the school building. We wanted to be able to deliver it to kids. We have some school districts that are literally delivering the food on their bus route. We have others that have set up feeding centers. So giving us that flexibility is very important. I talked to the president 2 nights ago, and getting that flexibility is what we need. We're also seeing, I've talked to Sherrod Brown, I've talked to Rob Portman, and then one of the good things out of this is there's no politics involved. There's no Republican. There's no Democrat. We're all Ohioans. We're all Americans, and we're all working together. The federal government has the packages that they're putting together for assistance. That is going to be very helpful as well.
Governor, I know that we have talked about the National Guard coming in to help. First question is, what are they expected to do when they do come to help? And also, Governor Andrew Cuomo out of New York is asking for the Army Corps of Engineers to come and help his state. Is there any anticipation that we here in Ohio will be needing the Army Corps of Engineers to help set up a system to assist our healthcare providers?
Well, we don't know that yet. We have a very robust National Guard. And when I say National Guard, I think sometimes people get alarmed. We're going to cordon off some area or do something like that. Just to give you an example how we're using the Guard, we received a request from hospitals to set up tents outside some of our major hospitals. The Guard has tents. They know how to set them up. They're going to be doing that. These tents will be used when we start getting more and more people coming in because of the coronavirus. So that's the type of work that I envision the National Guard doing. They're professional; they know what they're doing, and we'll use them, as we need their use.
Governor, we know that the shelter in place, essentially, we know we're asking people to self-quarantine for 15 days or so. When do you make the decision on when schools may resume, when we may return to business as normal? Will it be into May or even longer?
Well, we make that decision based upon where we are. I mean, again, the number one concern priority I have to have is protecting human life. That's the most important. We got to get through this. As I said 2 days ago on St. Patrick's Day, we got a lot of things closed down. The pubs are closed. The bars are closed. But next year at St. Patrick's Day, our goal is to have people there and all of us to get through this and to be able to celebrate and live our lives again and do what we want to do. So the priority is on human life. This virus is new. It's unique. We're not sure exactly how it's operating. It's being studied about what happened in China and Italy and other countries, so we do have some experience level. The best prediction is this thing may peak out May 1, but that's just the peak, and so you've got time certainly after that. So what I tell school children and what I tell their parents is settle in. This distance learning is going to continue for an extended period of time. Is it possible the schools will not come back, this school year? Sure, that's possible. We really don't know. But again, let's focus on what we have to do, which is protecting each other.
Governor, you've gotten a lot of positive response for being one of the first to really take a proactive stance, an aggressive proactive stance, along with several other governors across our country in New York, in California, Washington State. But we're seeing other states who have not taken that response. Are you concerned that self-isolation and what you're trying to do in Ohio is going to work if you have some of the other surrounding states not participating?
Well, I think every state is moving forward. Each governor's got to make his or her decision. I'm certainly in contact with different governors. But I think, we have to focus on what we can do, and that is establish that separation.
Would you like to see more of a coordination with perhaps Michigan?
I talked to Gretchen. I talked to the governor in Michigan, and we share ideas. And so we're going to continue to do that. So we are talking, and people can be assured that we're having communication. Frankly, we're sharing ideas. I mean, what are you doing? What are we doing? What do you think is working? What else can we do? Because with 50 states, there's always an opportunity to find somebody who's doing something that's different or unique and better. So I'm always looking for that.
Governor, the testing kits have been an issue nationwide, and we know that there are limited testing going on here in Cuyahoga County between university hospitals and also the Cleveland Clinic. Are you hearing those concerns? What are we doing to address that? And then a question that the viewers have been asking a lot, what if we don't have a primary doctor and we're concerned about our health? How do we get the help we need when we don't have medical coverage on a regular basis?
Well, that's a good question. I'm not with Dr. Acton. If I was, I would, get her on the phone. In regard to if you don't have a primary physician, but you need somebody, whether it's urgent care or somebody, you need somebody as the kind of your gatekeeper. And so that's what you have to do. As far as the tests, one of my messages yesterday at our daily 2 o'clock press conference is we are limited in the number of tests. We think we'll remain limited in that. And so we shouldn't fixate on tests. What we should fixate on is how we, stay away from each other, keep that distance, do all the things that we know that cuts down the odds of us getting the coronavirus. The tests are being used now when someone gets sick and they have to be admitted to a hospital. That hospital needs to know whether or not that person has the coronavirus or whether it's something else, and because that person has to be cordoned off from other
Sure.
people. It's also being used strategically. Let's say someone in a nursing home is sick. Well, you need to know whether that person has been infecting other people. So it's being used very, very strategically. Dr. Acton continues to tell us that 80% of us who get this will be able to stay home. Mm-hmm. You won't feel good. You'll go through it. But, you will not have to be admitted to a hospital. So most people are going to be able to stay home.
And Governor, the folks who are going to...
If I could just add, in many cases, the treatment is whether you've been tested or not, most people are going to be able to stay home.
The people who are going to work, you're asking those businesses to check their temperature before they come in. Logistically, how is this going to play out? And we've heard of businesses having issues even getting thermometers.
Sure. No. Look, they're having difficulty getting thermometers, and the context of what I was saying is, I was asked the question. I'm asked the question every day: are you closing all the businesses? The answer is no. But we're asking the businesses to be very, very, very careful and protect their workforce. I was on a call yesterday with the CEO of a company who had plants in China. And how did you get through it? Well, he said the way we got through it is we continued to work, but we were very, very, very careful not to let someone in who had a fever, not to let someone in the workplace who was not feeling well. And he said we continued to wipe down surfaces all the time. We established a distance requirement between people. So my point about taking people's temperature is, there's no requirement that you do it, but do everything you can to keep your workforce safe. That's good. That's a good business decision, but it's also a very good decision for those employees who are coming in there, every single day. And I understand that, thermometers, take your temperature. They're not always available. I get that. But try to take other precautions. Talk to the person coming in. How you feeling today? You feeling okay? If you're not feeling okay, go home. Wipe down the surfaces, use the Purell, do all the different things.
Governor, one of the quick questions I had for you before we wrapped up is about testing, and I have seen a lot of people asking this question. I don't even know if you know the answer. We've seen athletes and celebrities get tested, and I think people are wondering, how is someone getting an access to a test? Is it because they have the means or the celebrity, and how come it is so difficult for the regular person to be able to get a test when they've been waiting in these lines?
I have no idea how these athletes are getting it, if they are. All I can tell you is what our protocol is, and we have limited number of tests, and the tests are used very, very strategically in making these decisions as people who are sick. And people who are in a position where we need to know, the health professionals need to know, who else have they been in contact with? Someone that's in a nursing home, someone who's in close proximity to other people, someone who's at a daycare center. We got to know if that person that gets sick. We got to know whether or not they have this or not. So it's being used strategically. I've seen the same national stories about celebrities. I have literally no idea how that.
I think that's a lot of people are wondering that. Well, Governor DeWine, thank you so much for joining us this morning and answering some of our questions. I think a lot of people in Ohio are appreciative of the proactive actions that you are taking for all of our health. Take care of yourself.
Well, thank you. Look, we're going to come out of this. This is a resilient state, a resilient people. Stay safe, but the sun will come out. We're going to move forward, and we'll be back living our lives the way we want them. But to get there, we've got to restrict what we're doing right now.
All right. Thank you, Governor DeWine. We are going to take a short break. 19 News This Morning at 9. We'll be right back.